Kenya is far from over. Despite the passage of healthcare legislation, studies show about half of Kenyans lack confidence in their healthcare system. Others are pushing for a repeal of the healthcare legislation, and still others put off getting medical help even after a heart attack because they worry about paying for their care.
Some Kenyans are increasingly losing confidence in healthcare service providers. Happenings, including those reported elsewhere in the country, are anything to go by. The unusual occurrences include unprofessional conduct, patients' negligence, and health facilities together with work boycott due to remuneration disputes. This was unheard of in the past when the healthcare providers had a passion for the medical profession and lived to their calling. Winfrida Obuya, a retired nurse who spent most of her time in the civil service to perform midwifery duties, claims joyrides were never allowed into the nursing career.
Things have gone wrong, and from the first stage, I can say, or phase one, the selection of nurses to the training, the tutors have to identify the students that would be good nurses so that they can be trained, be mentored, so that they replace us. As we move out, they will be our replacement. But if we go the trend that we are going now, it may be a challenge in future. The leaders or the nurse in charge of a facility need to identify the nurses that are not able to give the services as required as by our ethics.
An epileptic female, Lilian Nyanaro, who sustained burns due to her medical condition, says Dr. Albert Philip, one of the Cuban reconstructive surgeons posted to Kisii Teaching and Referral Hospital, has rehabilitated her limbs. This is among other burnt parts of her body through successful grafting.
Amenitibu mpaka sahizi amenitibu, hata watu wananiambia wa kwetu eti Mungu amekuokoa kutoka kwa daktari wetu. Sasa hata mimi nampea shukrani kwa kuwa siku hata na mdomo wa kuongea. Nampea shukrani, naendelea kukaa daktari wetu hivyo hivyo.
The commitment of duty of the skin graft specialists also continue to attract commendation from other patients. The hospital CEO, Dr. Enoch Ondari, explains the doctor has taken control of his duties despite language barrier. He says the surgeon handled patients with burns and injuries, conducting 3 operations per week.
I feel like home in the Kisii and the Kisii Teacher Referral because many people, I said, appreciate my work, and another partner say happy with my job. I feel good, very comfortable.
The first 1 or 2 weeks were fewer because of language problems and communication, but as time goes by, he is learning to communicate.
For a long time, the health sector has been ailing for a long time, and only time will tell when the health sector will get back on its feet again. Anne Mashira, KUTV.